BNC, America's Black News Channel. Watch 15 minutes. Share with everyone. Finally, news that speaks to us.
Today is National Women and Girls HIV/AIDS Awareness Day. More than 1 million people are living with HIV in the U.S., and women make up nearly 30% of that number, especially Black women. According to the CDC, Black women continue to be diagnosed with HIV at disproportionately high rates relative to white and Latina women. Here with me now to discuss the rising rates is HIV physician Dr. Oni Blackstock. She's the founder and executive director of Health Justice, an organization that works to reduce health inequities in the Black community. Good to have you back with us, Doctor. Appreciate your time. Let's talk about this. In 2019, nearly 20% of new HIV diagnoses were among women, but still women are left out of the conversation when it comes to prevention and protection, mostly. Why is that?
Well, thanks so much for having me. And I'm really glad to be here, especially on this day, this awareness day that's really intended to raise awareness about the impact of HIV on women and girls, and also to show support for women and girls who are living with HIV. You know, globally, women are disproportionately impacted by HIV. More than half of people living with HIV globally are women. And in certain parts of the world, such as sub-Saharan Africa, about 75% of adolescents living with HIV are girls. When we look at the United States, we see less women impacted, but when we look at the women who are impacted by HIV, they tend to be disproportionately Black women. Black women account for about 50 to 60% of new HIV cases, although they represent less than 15% of the female population. And so it's a sort of mixture of, racism and sexism that has sort of increased the risks for Black women, but also led to the invisibility in terms of this issue garnering the attention that it deserves.
So what are the challenges that place Black women at higher risk for HIV?
Yes, so there are multiple factors that increase risk for Black women. And I'd like to just say also, I'm going to talk about both cisgender women, so women who are assigned female sex at birth and who identify currently as women, as well as transgender women, women who may be assigned male sex at birth, but who identify as women. For Black cis and trans women, they are dealing with issues around poverty, lack of access to quality care. We also have an issue, obviously, in the Black community impacted by mass incarceration, which really lowers the number of eligible partners for women. So women may be in situations where they have a partner who then has other partners at the same time, which then can drive the risk of HIV, as well as other sexually transmitted infections. There's also stigma. Women may not feel comfortable talking to their healthcare providers or peers about how to protect themselves. We also have transphobia, so it's very hard for women of trans experience to be able to find care that is as competent, high quality care, as well as just the resources and support to be able to stay safe and to protect oneself. So there are a number of factors that drive risk for Black cisgender and transgender women in the United States.
But how do you have that conversation with a partner, and how do you know if they're telling you the truth?
Right. Yeah. So it can be really challenging for women because it's often not their own behavior that places them at risk, but the behavior of their partners, as well as these community level factors. And so, we definitely want to, have women to feel empowered, to feel comfortable talking to their partners about their sexual history, asking their partners if they've been HIV tested. So knowing your partner's status in addition to your own is incredibly important. And so really having those sort of open-ended discussions, sort of tell me a little bit about, your sex life, tell me about, have you had any sexually transmitted infections? Have you been tested for HIV? Really having women feel empowered to ask the questions where the answers will help them to protect themselves. But that can definitely be challenging we know there are dynamics in terms of power, and many women may not feel comfortable doing so. So these are the challenges that we're faced with.
And are there any final tips or anything that women should be doing? Should they be going on a regular basis to their physician? Any type of testing, anything they can do in particular to protect themselves?
Yes, so as a primary care doctor as well as an HIV doctor, there are very few tests that are considered routine or screening. There are about two or three. An HIV test is one of those. So everyone should at least have at least one HIV test done in their lifetime. And if they are sexually active or concerned about their risk, asking their provider or going to a community-based organization to get tested, and also ensuring that if there are any partners that they have or people that they're planning to have sexual activity with, that they ask their partners about their status. And also the CDC has a wonderful website, cdc.gov, Stop HIV Together, which has tons of information about how women can stay safe, as well as about PrEP, which is a once a day pill that can prevent HIV infection.
Well, thank you so much for those resources. That's great information, Doctor. Thank you so much for joining us as always.